Every day, a working pharmacy must operate as a flawless precision system. Patient records and insurance data must synchronize perfectly, while controlled substance documentation and inventory databases have to work together in real time without a single error. When you introduce a major system transition or a software platform migration into that environment, the risk multiplies. You are moving live medication histories, allergy records, prescriber files, and active insurance data while patients are standing at the counter waiting for their prescriptions. A minor glitch in that transfer has immediate clinical and financial consequences. An outdated insurance record triggers an instant claim rejection. A lost allergy alert becomes an active patient safety risk, contributing to medication-related adverse events that cost the U.S. healthcare system up to $50 billion every year. In this environment, speed and accuracy cannot compete. They are absolute simultaneous requirements. Between 2019 and 2024, total prescriptions surged 15%, growing from 6.2 to 7.1 billion. Simultaneously, the workforce to handle it is rapidly shrinking. Pharmacy technician vacancy rates are currently hitting as high as 40% nationwide. The gap between those two lines represents a severe human toll. According to the Mayo Clinic Wellbeing Index, 65% of pharmacy professionals report burnout. That was the highest rate measured across any healthcare sector in 2024. When those overwhelmed professionals leave, the financial penalty is high. Industry estimates place the hard replacement cost between $25,000 and $35,000 for every single technician lost. This situation creates an extreme operational risk. When a massive, inflexible data migration project is added to the workload of a team that is already shorthanded, the remaining staff are pushed beyond their safety limits. Expecting that same internal team to flawlessly execute a major system transition while also processing daily claims and filling prescriptions creates a scenario where errors are much more likely to occur. Forcing internal staff to do two jobs simultaneously creates too many points of failure. A more stable approach involves a dedicated, healthcare-trained support team to step in and absorb the transition workload. This is where Staffingly intervenes. They provide an external support partner built specifically to handle complex pharmacy operations and high-stakes data migrations. For urgent rescue situations, Staffingly deploys rapidly, onboarding a specialized team and going live in 48 to 72 hours. Physically separating project management from daily operations protects live patient care. The pharmacy staff focuses on the patients at the counter, while the external team manages the technical transition in the background. To maintain accuracy, Staffingly uses a hybrid workflow. First, AI tools scan clinical documentation, filtering potential anomalies. Second, healthcare-trained professionals investigate every flagged discrepancy, ensuring data meets accuracy standards. This identifies duplicate profiles and outdated insurance records, resulting in a clean data stream. The entire workflow is governed by strict regulatory standards. Staffingly operates with built-in HIPAA, SOC 2 Type 2, and HITRUS compliance. Combining automated screening with specialized human review provides a clear blueprint for maintaining data integrity and meeting compliance requirements throughout the transition. This methodology has been validated by pharmacy operators. Look at this 5-star Trustpilot review from a U.S. pharmacy practice administrator. They highlighted 3 specific results. The support was fast, helpful, and had good communication. That level of transparency is what allows a pharmacy administrator to stay informed during a high-stakes transition. Daily status reporting ensures that questions are answered and issues are identified before they affect live operations. This chart compares the economic impact of different staffing models. Building an in-house team with pharmacy expertise typically costs between $30 and $45 per hour once you include benefits and payroll taxes. By comparison, Staffingly's healthcare-trained professionals start at $8 to $10 per hour per full-time equivalent. This represents a potential savings of 70% on staffing costs, while also removing the time and expense of recruiting and training new hires during a period of high industry turnover. The transition to this model is handled through a structured onboarding process, including a 2-week risk-free pilot program that requires no long-term commitment. Managing high-stakes data operations through specialized external support addresses the immediate problem of staff burnout while creating a more sustainable financial model. You can book a demo at staffingly.com to see how this approach works for your next system transition.